Strep throat and mononucleosis mono are two distinct infections that often get compared due to their overlapping symptoms. Strep throat is a bacterial infection caused by Streptococcus pyogenes, leading to a sore, scratchy throat, pain while swallowing, and sometimes fever and swollen lymph nodes. On the other hand, mono, known as the kissing disease, is a viral infection caused by the Epstein-Barr virus, featuring symptoms like extreme fatigue, fever, sore throat, and swollen glands. While antibiotics are effective in treating strep throat, mono is generally managed with rest, hydration, and over-the-counter pain relievers since it is viral in nature. People with weakened immune systems or those in close contact environments such as schools are more at risk for both diseases. Here's a more detailed look at the contrasting and detailed aspects of strep throat versus mononucleosis. Infectious agent bacterial strep versus viral mono. When distinguishing between streptococcal pharyngitis, strep throat, and mononucleosis, mono, the causative agents play a key role: bacteria for strep and a virus for mono. Strep is caused by group A Streptococcus bacteria, which makes it amenable to antibiotics like penicillin. Conversely, mono is typically caused by the Epstein-Barr virus, EBV, lacking a quick fix, as viral infections do not respond to antibiotics. Despite both diseases presenting with sore throat and fatigue, mono often includes broader systemic symptoms like swollen lymph nodes, fever, and the notorious spleen enlargement, which can persist for weeks, far outlasting the more acute symptoms of strep throat. Primary transmission, direct contact strep versus saliva, mono. When doctors are faced with a patient presenting with a sore throat and fatigue, discerning between streptococcal pharyngitis, strep throat, and infectious mononucleosis, mono, commonly caused by the Epstein-Barr virus, is crucial. Strep throat is highly contagious and spreads through direct contact, particularly when an infected person coughs or sneezes, and others touch their mouth, nose, or eyes after contacting contaminated surfaces. Mono earns the nickname the kissing disease, since it's often transmitted through saliva, but can also spread via other means, like sharing drinks or utensils. These transmission nuances imply different precautionary measures. For strep, hygiene and surface disinfection take precedence, while mitigating saliva exchange is paramount for preventing mono. Typical age group, children and adolescents strep versus adolescents and young adults, mono. Strep throat, primarily caused by Streptococcus pyogenes bacteria, commonly affects children and adolescents. Its presentation includes sudden onset sore throat, pain on swallowing, and often fever without coughing or nasal congestion. In contrast, mononucleosis, or mono, caused mainly by the Epstein-Barr virus, EBV, is dubbed the kissing disease as it spreads through saliva and is most prevalent among adolescents and young adults. Symptoms are more insidious in onset, including persistent fatigue, fever, a sore throat that can mimic strep, and swollen lymph nodes. Recognition of the typical age group and symptom presentation aids in accurate diagnosis, which is essential since treatments for bacterial strep and viral mono differ significantly. Duration of symptoms, acute strep versus prolonged mono. When discerning between strep throat and mononucleosis, mono, the duration of symptoms is a pivotal factor. Strep throat, caused by the bacterium Streptococcus pyogenes, typically manifests as an acute infection. Patients often experience sudden onset sore throat, fever, and swollen lymph nodes, with symptoms usually resolving within a week with appropriate antibiotic treatment. Conversely, mono, often caused by the Epstein-Barr virus, unfolds gradually and can linger for weeks or even months. Mono's hallmark includes prolonged fatigue, a persistent sore throat without the bacterial infection signs, and sometimes an enlarged spleen. Understanding the temporal nature of these symptoms can significantly aid in accurate diagnosis and effective management. Complications risk, acute rheumatic fever strep versus splenic rupture mono. In the differential diagnosis of strep throat and infectious mononucleosis, mono, a key consideration is the risk of complications unique to each disease. Strep throat, if left untreated, can lead to acute rheumatic fever, ARF, a serious inflammatory condition that can affect the heart, joints, nervous system, and skin. Meanwhile, mono, caused by the Epstein-Barr virus, raises the concern of splenic rupture, a rare but potentially life-threatening event. The spleen may become enlarged and more vulnerable to rupture in patients with mono, and this necessitates careful physical activity restriction during the acute phase of the illness to prevent trauma to the spleen.